Hello, I am Dr. Shoshana Deaton. I am a family physician at the Clarence Rockland Family Health Team and physician co-lead at the Rockland COVID Assessment Center. I am also a mother of 2 girls in elementary school who are now eligible to receive their COVID vaccination. I would like to share relevant information about kids and vaccination that was presented by Dr. Kieran Moore at his November 26th presentation to a group of family physicians, as well as from an informational document from the University of Waterloo. I don't have any conflicts to declare. I would also like to mention that my only bias is a respect for the scientific principle. What I will present to you today is based on data, but we must also accept that things continue to evolve. Some parents ask themselves, why would I vaccinate my child if COVID isn't that bad in kids? Yes, for the most part, children will have mild symptoms from COVID, but the limits on their ability to attend school, limits on their activities, travel, and gatherings of friends and family members is taking a heavy toll, and vaccination represents one of the ways out of this, because when their parents and grandparents get seriously sick, this obviously affects their well-being. Even if most kids will have mild symptoms, some will be hospitalized. Nearly all who develop multisystem inflammatory syndrome will be admitted to intensive care. Even kids with an initial mild illness could develop long COVID with fatigue, headaches, and a change to their taste and smell for many months. This can affect from 1 to 4% of children. At the beginning of the pandemic, we were relieved that children were not as affected by COVID as adults. There was also the impression among some people that kids were not as easily infected and did not easily transmit the disease. Unfortunately, with the Delta variant, we see very well that kids are transmitting COVID quite effectively. Kids from 5 to 11 years old represent the majority of cases in Ontario. With more liberal transmission, we can now see the real impact of COVID on children. The rate of hospitalization in kids 5 to 11 years old is 1 in 385, and it is even greater in those less than 5 years old. It's easy to downplay this and say that they rarely end up in intensive care, and most don't die. But have you ever had a child admitted to hospital? Have you ever slept in a fold-out chair next to their bed, possibly separated from your other children and your partner night after night? It breaks your heart and disrupts your life. You may still be thinking that hospitalization is still unlikely since your child is in good health. First, I find it heinous that we aren't doing all that we can to protect vulnerable children. But maybe some people need to hear the following. More than half of kids admitted to hospital did not have underlying conditions. We see here a graphic representation of data from 2 studies showing 55% of kids admitted to hospital for COVID may have resembled your child. Don't forget that underlying conditions can be seemingly banal, like asthma or even obesity. We admire the rolls and chubby cheeks on our young kids, and as I often see in my practice, a fair number are obese and many parents are unaware. So, I will take a moment to go back to my previous slide so that you can interpret it with a new appreciation that all our kids are in the same boat. This brings me to the COVID vaccine. Now that we know why we want to avoid infection in our kids, I will confront the hesitation parents have around vaccination. I have heard from parents that were concerned that there might be unknown long-term consequences, or who did not want their kids to experience the discomfort of the short-term side effects, or who were concerned about the impact on fertility. Often the greatest concern is regarding the potential for inflammation of the heart, called myocarditis. I will start with the most common concern. I first want to say that it is true. Vaccines have side effects. I am here to be transparent and I don't want to mislead you. Like all medical interventions, things can go badly. But if we do nothing, inaction can be worse. In our current situation, we have 2 choices. Our kids can get COVID or they can be vaccinated. Masks and social distancing will not be here forever. If your child gets COVID, their risk of myocarditis is greater, and in general, their symptoms will be more serious than if they were vaccinated. If you have a girl, her risk of myocarditis is 133 times greater with COVID than from the vaccine, and she will be much sicker from COVID-associated myocarditis. We think that myocarditis depends on hormones, so our boys are at greater risk. However, even for boys, they are 26 times more likely to have myocarditis because of COVID, which could also be more severe than if they had gotten vaccinated. I just wanted to put the risk in perspective. Alex Munter, president of CHIO, gives us local numbers. The number of children and youth admitted to his hospital since the onset of the pandemic for COVID equals 39. Those admitted for myocarditis or pericarditis after vaccination, 0. The side effects of the vaccine are similar to what we see in adults, but may be less frequent. Kids can have headache, muscle pain, fever, and local pain and swelling. There may be a greater chance of redness. Children will receive 1/3 of the adult dose. If they are 11 now, it is not necessary to wait for their 12th birthday to get a bigger dose, as 1/3 is more than sufficient regardless of the size of the child. My daughter is 5'4", and I am very comfortable with the protection she will receive. In addition, all kids born in 2016 or earlier can get vaccinated without waiting for their 5th birthday. As of January 1st, children born in 2015 or earlier will be able to receive the vaccine. As a result, all children from junior kindergarten and onwards can and should receive 2 vaccines by the month of March. The gap between the 2 shots is 8 weeks because this gives a more sustained protection and possibly a smaller risk of myocarditis, though this risk remains quite rare. It is important to know that no vaccines cause side effects that emerge after 2 to 3 months. Children followed by the COVID vaccine study have passed that time period, and nothing else has come up. Nearly 3 million American children have received their first dose, and no new side effects have emerged. The risk of anaphylaxis or serious allergic reaction is rare and is around 1 in 100,000. The COVID vaccine has no impact on fertility. It cannot change DNA. There have been reports that it can cause fluctuations in menstruation for 1 to 2 cycles. This is not dangerous and reminds us of the role the endometrium plays in the immune response. For hesitant moms who are listening, there are hundreds of thousands of pregnant women who have received the vaccine and who have been followed, and there is no evidence that there is a risk of miscarriage, stillbirth, or complications. But if they get COVID, pregnant women are 10 times more likely to end up in intensive care and 2 times more likely to have a stillbirth. I am repeating myself, but it is important to understand that COVID is very contagious, and if you do not vaccinate your children, they will be infected. Most kids will be exposed within 1 year, and while many will be okay, COVID can have serious effects on all children, not just those with underlying health conditions. So I encourage all of you to vaccinate your children as soon as possible. Thank you.